Hans tu temptik Darcy McGilvery Sigason. Hanutsu muta e pe pixquan mumuma axun covid-19 sigatan. Maga tu temptik tena ai man humuma hanuts kataski no tene magwe ma humuma. Maga elgo e an egoneka atuskewino aquista tene I algamemo tsika tsipugo. Tu temptik egonek wista tene egoe tsipugo atuske tsika programs. Maga nistanano muta nigani wak e namoy puya aku muta. Itene algamemo tan tu temptik. Kistao ekta ite magpagsimtagok tene algamemo kistao amate tu temptik kakyo. Good morning everybody, Darcy McGilvery. Today I'm here to talk a little bit about our current situation in Saddle Lake regarding COVID-19 and how it has affected our community. Thus far, we have had some meetings in relation to the day-to-day operations as how it has affected our programming. So I'm here to read a few statements as to how we plan to move forward in relation to the restrictions under the provincial guidelines, AHS, and so on. But in doing so, I'm also here to suggest and encourage that everybody does have a part in this work that needs to be done. So at the request of our emergency management team, a meeting was conducted yesterday to prepare a strategic plan of action that would assist us in providing support to our local health department and staff personnel. The Saddle Lake Cree Nation leadership stands behind and supports all efforts of the health center staff and emergency management team that have been working from the beginning to ensure services are being provided. As of late, this process has been hindered. That being said, staff are still working from home and are trying their best to maintain services for our nation. Personally, to Temptik, I want to extend a heartfelt thank you to the people at the healthcare center. We talked about this as the health center being one of our pillars, one of our main pillars that hold up our nation. They take care of our elderly, our youth, our children. They take care of our sick. And now they need our support because some of their own are feeling the effects of being that frontline worker for all these months since COVID has hit our community. They have been there for us. So I want to thank each and every one of the staff in all departments at the healthcare center. With that, also I need to extend that thank you to all departments that are continuing to work diligently throughout this whole pandemic, from finance to education, social. All these departments need to be made mention. Everybody is in this together, so we need to get out of it together. So with that, I want to continue to encourage the staff to get well, to heal at home, because we need you back there when you're ready to do so. It is extremely important to stay home. Experiencing any symptoms such as fevers, coughs, headache, sore throats. Members must take this advice of isolation orders very seriously. Once again, to Temptik, if and when we have the order to isolate, it is important we adhere to those orders. The nation is counting on us to abide. The supports will be there for you. If they've been advised by Alberta Health Services or Saddle Lake Healthcare Center and informed to stay home for a certain amount of time, members need to listen to this. This includes visiting family and loved ones. So continuously having family members to visit the home while under insulation is not a good practice. As difficult as it may be, let people know they cannot enter your home. Otherwise, there's other ways to show that you care, such as drop off care packages on the doorsteps, bringing food, water, games, puzzles, snacks, etc. Short visits outside and in between the window, having the window pane between you, practicing physical distancing, reaching out and asking family, friends, and elders or neighbors if they need anything. So if you know one of your neighbors is in isolation, do a quick reach out by phone or text message. Call each other. There's other ways through social media you can reach out. FaceTime, Skype, Zoom, and many other forms of communication. Only essential travel is recommended at this time. This means leaving home for groceries, prescriptions, medicals. Those are only the ones that we're asking the nation to be driving around in our community for. Food and medical needs. One healthy member of the household to shop. So we will take turns shopping for the household. Continue to practice all safety protocols, such as washing your hands, sanitizing hands regularly, wearing a face mask in public. Avoid visiting and events and gatherings in large groups. Continue to practice social distancing, 6 meters, 6 feet, 2 meters. Let's use these next few weeks to allow our community to heal properly. Now, once again, to Tempting, we all have a very important part to play in this next few weeks. It's up to our members to help each and every one of us by giving us that time to heal, by getting back to the basics of what it's going to take for us to get past this and flattening that curve, as they say. I need to really make mention of the funeral process, the procedures. Now, once again, we are very limited on what we can offer the community when it comes to funerals. It is a difficult time, we know that, but under the Alberta Health guidelines, we have either through Grace Gardens, where the family would have to do the viewing there, and then they're spread out about 6 feet in their little viewing room, and it's kind of, it's really, it's a hard procedure for families to witness and to be a part of. The second step is to allow the hall to be continued to be utilized. But then again, we need the family members to step up and help make sure that everybody at the wake or the funeral are abiding by these guidelines. Those guidelines are there to protect us, to protect your children, to protect your family. So by tracing, continuing to take care of the tracing, the sanitizing of the tables, the chairs, the microphones, and right down to the cooking in the kitchen, the utilizing of the services. So to Tempting, everything about our world has changed since COVID has hit our nation. Everything. But we can still get through this together. I am here to read the next part of this shelter-in-place procedure. Due to the current situation in our nation and surrounding communities, the emergency management team, in consultation with the Council of Saddle Lake Cree Nation, have determined to close all programs and schools in the nation itself. So the services will be no longer in person. We have to have our staff work from home, and all essential programs, all essential services will continue to work, but at a scaled back version. This precautionary measure is being taken to support the health and safety of the staff that have been affected and to slow down the spread of this virus. Services will be closed from November 2nd, 2020 to November 20th, 2020. We appreciate that this will impact service delivery, and we are providing contact information for all programs and services to ensure needs are being met at this time. At this time, it is recommended to reinforce the safety precautions that were taken early on in this pandemic, which were successful in preventing the virus from entering our nation for almost 6 months. So once again, we're going back to the procedures we had taken when COVID first entered. We were successful in keeping it away for 6 months, so we're going back to those student. Shelter in place, stay at home. Please keep the children at home. If you don't have to go anywhere, let's all stay home. Restrict travel to essential travel only. Once again, we talked about that. Groceries, work, medical appointments. Avoid social gatherings, visiting, and events. That includes events. Band meetings are another area that we need to talk about later on. There will be more information as we go forward. Sanitize and wash your hands. Wear masks in public. Maintain social distancing. So we will be doing our best to support our nation remotely. Referrals for isolation support will be made by the contact tracing team. Supports will only be provided for on-reserve members that have been verified that they are in isolation. So once again, if you are needed those supports, you have to be, you need to make those contacts with the health center. Let them know that you are either have been in direct contact with somebody who's either COVID positive, or maybe you have these symptoms. So please, there's nothing about shame in the picture anymore. This is about our health and our survivability for our nation and our youth and our elders. Individual programs will be providing their process for remote service in the coming days. So once again, we're talking about trying to deliver these services remotely, either through cell services, through Skype, through all these areas. And the only other programs that will be going are the essential, the trucks, the ambulance services, the emergency troubleshooters, things like that. So additional notes: if and when you need to work with the health center, please bring your Alberta healthcare card. They need your date of birth. Please phone ahead for appointments. And once again, this is all the honor system that we're going to be utilizing, which means we are all accountable to this process. If it's going to work, we need everybody to do their part, stay home if they don't need to go anywhere, and we will get to that point where we can look at this as a distant memory after we flatten that curve. So in closing, Tutemptek, I need to thank you all for your patience, your due diligence, and all the hard work we've been doing this far. I need to also thank all the program directors, their staff. Without this, we would never be able to make it this far. We almost went 7 months without having this pandemic in our community because of the hard work of these departments. the community monitors, emergency management department, the healthcare center staff, right on to finance, social, education, all the departments that are involved. We need to thank these people. They keep us safe. So once again, on behalf of leadership, I wanted to thank you. I need to make mention also the Saddle Lake Cree Nation News and Events Information Facebook page is our official page that we will be rolling out information on, so not everybody's not confused as to where the information will be coming from. This has always been our official page. That's the way we'll be going with it. So in closing, once again, Sagitina o kakyo tutentik. Hi. Thank you.